Welcome to the deep dive. We recently got hold of this really interesting collection of materials.
Yeah. What's in it?
Well, it's a medical dictionary, a bibliography, and a research guide, and it's all focused on oral sex.
Okay, that's specific.
Right. And, at first glance, you might think, how much is there really to say?
Yeah,
But we were genuinely surprised by the sheer amount of information out there.
absolutely. And this isn't just, opinions or anything. We're talking actual medical literature, scientific studies.
Exactly. Peer-reviewed stuff.
Yeah, and patents, too, which is interesting, plus resources for doctors and patients. It really shows how science digs into, well, almost every aspect of human life, doesn't it?
It really does. So our main guide here is this 2004 publication. It's called Oral Sex, a medical dictionary, bibliography, and annotated research guide to internet references. Quite a title.
Doesn't exactly roll off the tongue.
No,
Right.
but inside, it references just tons of studies, patents for related gadgets, books, even videos, and directories for finding even more info online and in libraries.
So the goal today, I guess, is to pull out the key stuff, the most interesting bits from all that.
Precisely. We want to give everyone listening a clear overview, highlight the important findings, the useful resources, but without getting bogged down in, super technical jargon.
Right, like a crash course, get you up to speed quickly.
Exactly. Your efficient guide to getting pretty knowledgeable on this topic.
Okay, sounds good. Where do we start?
Okay, let's dive right in. The first big chunk of the guide is all about studies on oral sex. And, well, almost right away, HIV risk and prevention jump out.
Yeah, that seems to have been a major focus for researchers for quite some time.
It really does. And looking back, you can see how the understanding kind of evolved. There are articles from '96, for instance, discussing different approaches for gay men like risk elimination versus harm reduction.
Right, and one article in Focus, A Guide to AIDS Research and Counseling, mentioned the CDC back then favored client-centered risk elimination.
So not just saying stop, but helping people make choices to avoid risk altogether.
But then, another article from the same year, this one in the Journal of Gay and Lesbian Social Services,
Okay.
a clinical psychologist argued that if the guidelines about oral sex weren't super clear, maybe even contradictory, well, that could actually lead to more unsafe behavior.
Huh. That's a really crucial point about public health messaging, isn't it? Clarity is key.
Absolutely. If it's confusing, it might backfire.
Then, fast forward to the early 2000s, we see NIH-funded projects popping up,
National Institutes of Health, yeah.
specifically looking at how HIV might be transmitted through oral genital contact. One summary from the University of Washington in 2002.
I think I saw that one. Critchlow's study.
That's the one. It noted the risk seemed lower than vaginal sex, but it was really hard to pin down a number.
Why was that?
Well, apparently because people very rarely only engage in oral sex. It usually happens alongside other activities.
Ah, okay. Makes it hard to isolate the risk. The Critchlow summary also pointed out something important, didn't it?
Yeah, that while other high-risk behaviors might have been going down in some groups.
Unprotected oral sex was actually becoming more common.
Right, which really put the spotlight back on understanding the specific risks there.
And they proposed that study in Senegal, too, looking at fellatio among sex workers. Shows it was seen as a global issue.
Definitely. And other NIH projects around them looked at different angles. UC San Diego, for instance.
Patterson's group.
Yeah, they focused on methamphetamine users, noting the link between stimulant use and high-risk sex, including oral sex.
Trying to develop long-term risk reduction strategies.
It shows how interconnected things are, right? Substance use impacting sexual risk behavior.
Exactly. You often need a multi-pronged approach for complex issues like that.
Then there was some really fascinating basic science research being funded. University of Minnesota Twin Cities.
Hertzberg, yeah, 2003.
That's it. Looking at oral epithelial cell, the cells lining the mouth.
As like immune gatekeepers against HIV. That's cool.
Yeah. The idea was these cells might react to HIV exposure, maybe ramping up certain immune molecules.
So the mouth itself might have defenses. Or potentially even help the virus. They were exploring that.
Right, potentially influencing transmission. And then University of Texas Medical Branch Galveston.
Cloyd's project.
They were looking into whether you could get a temporary HIV infection from oral exposure.
Temporary. How would that work?
Well, they had data suggesting maybe transient antibodies, or even the virus showing up briefly in some high-risk folks after unprotected oral sex.
Wow. So maybe not a full-blown persistent infection, but some initial activity. That raises questions.
It really does.
Right.
And Minnesota, again, another 2003 project, this time looking at tonsils.
John F. study, tonsils as a target.
Yeah, both as maybe a primary site for the virus to get in and also as key spots for triggering immune responses, like systemically.
Makes sense. They're lymphoid tissue, right there in the oral cavity. Prime real estate for viruses and immune cells.
And understanding that could be key for things like mucosal vaccines, which that project was exploring.
Right. So beyond these big projects, the guide also points to lots of articles in PubMed.
Yeah, the big medical database, a 2000 JAMA article saying the risk might be higher than people thought.
JAMA Journal of the American Medical Association, big deal.
A 2003 article in AIDS on transmission among gay men via oral sex.
And even a case report way back in '89, New England Journal of Medicine.
Yep, documenting woman-to-man HIV transmission through oral sex.
So the medical community was definitely recognizing it as a potential route, even if the risk was generally lower than other routes.
And that 2002 AIDS article actually tried to estimate the specific risk for men who have sex with men.
Putting numbers on it, trying to quantify.
And for doctors. There's a 97 article in the Journal of General Internal Medicine.
Giving advice on how to counsel patients about oral sex risks.
So healthcare pros were getting specific guidance on how to talk about this.
Which is crucial. Good doctor-patient communication is everything for informed decisions.
Okay, shifting gears slightly.
Okay.
The guide also mentions studies looking at links between oral sex and other stuff, like oral cancer.
Right. There was that 2000 study in the British Journal of Cancer done in Italy.
What did that find? A clear link.
Well, it was a bit inconclusive on the oral sex connection itself. They did find that people with oral cancer tended to have worse general mouth condition, gum bleeding, tartar, irritation.
Okay.
But they didn't see big differences in reported sexual practices, including oral sex or history of STIs between the cancer group and the control group.
So what do they make of that?
They suggested maybe HPV, human papillomavirus, was being transmitted non-sexually in those cases, or perhaps HPV is only involved in a smaller fraction of oral cancers than previously thought.
Interesting. So HPV is a known risk factor, but maybe oral sex isn't the only or even primary way it gets involved in all oral cancers.
Exactly. It's probably complex, involving multiple factors.
Okay. The guide also hits on studies about other STIs, like a 1999 study in Singapore.
International Journal of STD and AIDS.
Yeah, looking at pharyngeal gonorrhea, gonorrhea of the throat, and inconsistent condom use during oral sex among female sex workers.
Clearly showing gonorrhea can be transmitted orally, and inconsistent condom use is a factor, especially in groups with higher STI rates.
And a 2000 article followed up, looking at why condom use for oral sex was inconsistent in that same group.
Understanding the barriers and motivations is key for designing effective prevention, right?
Yeah.
Tailoring it.
Makes sense. Then there are some rarer things mentioned. A 2002 report about invasive group A strep.
The bacteria.
Yeah, linked with both an IUD and oral sex.
Wow, okay. Probably rare, but shows bacteria can travel via oral contact.
And going back even further, some 92 articles. One in The Lancet on allergy, oral sex, and HIV.
Allergy, that's different.
And a couple in 92 exploring recurrent vaginitis and oral sex.
So they were thinking about broader health implications even back then. Allergies, infections, suggest complex interactions.
And the guide mentions review articles from 98, 99 in sexually transmitted infections.
Pulling together existing research on oral sex and STI transmission, both viral and non-viral.
Those reviews are always helpful, right? Synthesizing what we know.
Definitely. Shows where the gaps are, what needs more research.
And way back in 88, a study looking at oral sex as a risk factor for, let me get this right, chlamydia negative, urea plasma negative, non-gonococcal urethritis.
Huh. Quite a mouthful. Basically, urethral inflammation not caused by the usual suspects.
And they were asking if oral sex could play a role in those cases.
Shows the effort to understand all potential causes, even for less common presentations.
Okay, changing focus again. What about adolescents? The guide includes studies on teen behavior.
Yeah, a 2003 study in the Journal of Pediatric Psychology looked at teens doing oral sex, their peer popularity, what they thought their friends were doing.
So the social context, peer influence.
Exactly. Understanding how teens make decisions in their social world.
And a 2000 article in Family Planning Perspectives asked a really basic question.
Which was?
Is oral sex even considered sex by teens? Or is it seen as abstinence?
Whoa, that's fundamental. How you define it massively impacts survey results, sex ed programs, everything.
Huge implications. If you're running an abstinence-only program, But teens doing oral sex think they're abstinent.
Right. You're not on the same page at all.
And there was even an 85 study looking at oral sex in teens, so it's been on the radar for a while.
Tracking trends over time is important for understanding how behaviors change.
Then just some general prevalence info. A 2003 Australian study.
Australian and New Zealand Journal of Public Health.
Yep. Reported on first experiences with both vaginal intercourse and oral sex in Aussie adults. A snapshot of norms there.
Cross-cultural data is always interesting. See how things vary.
And finally, a couple of articles from the Journal of Forensic Science Society, 88 and 92.
Forensics.
Yeah, discussing prevalence and how to prove oral sex occurred, probably in assault cases or investigations.
Ah, okay. Scientific proof would be critical in a legal setting.
Right. Okay, let's shift to something totally different and honestly kind of surprising. Patents.
Patents related to oral sex? Seriously.
I was taken aback too. People have actually invented devices for this.
Well, patents often reflect needs or anxieties in society, right? What are these ones about?
A lot seem focused on preventing STIs, which makes sense given the timing, especially around the HIV epidemic.
So addressing those specific concerns.
Exactly. The guide gives examples. Patent number 5,318,043, filed way back in 1989.
Okay.
For a condom for oral genital use, describes a device worn in the mouth with flanges to grip the lips, protects the mouth and genitals.
Worn in the mouth. Interesting design.
And the patent text itself is revealing. It explicitly mentions fear of HIV and other STDs, and says traditional condoms aren't really suitable for oral use. Notes, the mouth itself, with tiny cuts, can be a transmission route.
So the inventor clearly saw a gap in protection and tried to fill it.
Totally.
Yeah.
Then there's patent 5,649,549 from 95. Also a contraceptive device for oral sex, again focused on reducing STI transmission risk.
Same theme protection underscores the awareness of risk and attempts to engineer solutions.
And patent 5,390,681 from 93. A prophylactic device for oral sex.
Prophylactic, okay.
This one has a body part and reservoir. The description notes, regular condoms don't stay on a tongue well.
Practical consideration.
And that existing oral condoms back then could be uncomfortable or hard to use.
So trying to improve usability makes sense. If it's awkward, people won't use it.
And one more, patent 5,388,592, also from 89, for a protective mask.
A mask, like a surgical mask.
Sort of. Described as a flat membrane covering the lower face. For oral sex, or even mouth-to-mouth resuscitation.
Wow, broader protection.
Yeah, to prevent disease spread. It mentions limitations of earlier mask designs in coverage and allowing jaw movement.
Considering multiple angles of potential transmission. Fascinating.
But then shifting gears completely, there's a patent application from 2000
Okay.
for a lingual vibration device.
Ah, so not just protection, but enhancement. Pleasure.
Exactly. Takes it in a totally different direction.
Patent applications give you a peek into ongoing innovation, different motivations, clearly a market for sensory enhancement too.
And the guide even tells you how to use the U.S. Patent Office website, uspo.gov, to search for more patents on oral sex.
That's a great resource. Anyone curious can go digging into oral sex tech history.
Seriously.
Yeah.
Okay, moving from inventions to books.
Books on oral sex.
Well, books that touch on it. You probably won't find entire textbooks just on this, but it comes up in different contexts.
Right. Sexual health, relationships, even fiction, I imagine.
For sure. One example they mention is pretty wild. A chapter in a book called AIDS, the Women.
Okay.
It's a fictional scenario. A health educator assessing HIV risk for a vampire, engaging in oral sex during menstruation.
A vampire. Okay. That's
Creative.
definitely memorable. But I guess it uses an extreme case to illustrate risk assessment principles.
Clever in a very unusual way. What else?
A 2002 book, Making Love Again. It's a real couple's story about regaining intimacy after the husband had erectile dysfunction from prostate cancer treatment.
So dealing with physical challenges. Right. And a chapter mentions oral sex as an important way they maintain physical pleasure and connection.
That really highlights its role in intimacy, especially when other sexual expression becomes difficult.
Absolutely. Then there's a Canadian Public Health Association booklet, Frequently Asked Questions about HIV/AIDS.
Sounds practical.
It directly addresses HIV risks, including safer sex practices and specific guidance on reducing risk during oral sex.
So, public health bodies providing clear, direct advice, essential stuff.
And the guide notes you can check online booksellers like Amazon, but
be warned.
yeah, searching oral sex might bring up non-medical titles too. So filter carefully.
Good point. The term exists outside of science.
Next up, multimedia. videos and such.
Visuals can be powerful for health communication, especially for younger people.
Totally. The guide mentions one called Teens Talk AIDS.
Okay.
Features teens discussing AIDS, busting myths, talking condoms, and also mentioning oral sex risks and using dental dams.
Having peers talk about it can be really effective for teens. More relatable, less preachy.
Definitely. Okay, now we get into resources specifically for doctors and healthcare professionals.
The heavy hitters.
The guide links directly to various NIH institutes, National Institutes of Health. They offer clinical guidelines, fact sheets, tons of stuff.
Those NIH resources are gold standard for clinicians. Evidence-based guidance on diagnosis, treatment, prevention.
And it lists links for institutes covering everything: general medicine, cancer, heart, lung, blood, infectious diseases, even dental research.
Shows how oral health and sexual health can connect to so many different medical fields.
The guide also outlines key NIH databases: bioethics, HIV/AIDS resources, PubMed again, biotechnology, cancer info.
Essential tools for researchers and doctors to stay current, find trials, all that.
It also mentions other commercial databases exist beyond NIH.
Right. Subscription services with more specialized tools or analysis.
Then, resources for patients. The guide stresses that government agencies, federally funded groups often publish patient-friendly guidelines.
Clear, accessible info for the public, crucial for health literacy, empowering people.
It recommends using sites like the National Guideline Clearinghouse, Health Finder, searching for oral sex.
Good starting points for reliable info.
And it mentions the main NIH search tool lets you search across like 100 NIH sites.
Could be a mix of professional and patient stuff, but still useful if you use good keywords.
It also lists general search engines, Google, WebMD, Yahoo, but adds a caution.
Yeah, always got to check the source credibility with general search results, especially for health info. Look for reputable orgs.
Good advice. For staying current, it suggests news archives, Reuters Health, NIH News on Medline Plus, even tech news wires for new tests or procedures.
Keeping up with developments is important for everyone.
And finally, for patient resources, how to find medical associations that might have info. Lists directories like the National Health Information Center.
Associations often have great patient education materials, support info.
And it gives instructions for finding medical libraries via the National Network of Libraries of Medicine, plus lists libraries in the US and Canada with public access.
That's fantastic. Libraries offer deep dives into journals, books, plus librarian help. Great for serious research.
Seriously good resource list.
Yeah.
Last but not least, online glossaries.
Medical dictionaries online.
Yep, loads of free ones.
Yeah.
The guide highlights how key understanding the terminology is.
Absolutely. You hit a word you don't know, the whole meaning can be lost. Online dictionaries are super handy.
It lists great examples from the National Library of Medicine: ADEM, Medical Encyclopedia, MedicineNet.com, Merriam-Webster Medical.
All solid, reputable sources for definitions.
Even points to multilingual glossaries, rare disease dictionaries, tech glossaries, shows the breadth available.
Really empowers people to understand complex medical stuff.
And the guide itself wraps up with its own oral sex dictionary, defines key terms we've touched on.
Like
Antigen, antiviral, asymptomatic, bacteria, condoms, HIV, HPV, immune response, infection, oral, penis, semen, STD.
kind of a mini glossary right there.
Super helpful to have those core terms defined right in the context of the guide. Keeps everyone on the same page. So wrapping this deep dive up, it's really striking, isn't it? What seems like a simple topic has this incredibly deep, complex body of knowledge behind it.
Absolutely. We went from HIV research in the 90s
2 patents for specialized condoms and masks.
to resources for doctors, patients, library directories. It's vast.
It really highlights how things like the HIV epidemic, scientific progress, they drive research and even tech innovation in really personal areas.
Yeah, and what struck me was the clear awareness, even decades ago, of the limits of traditional protection for oral sex and the anxiety around transmission driving those patents.
It really makes you wonder what other topics that seem maybe niche or straightforward actually have these huge evolving worlds of information behind them.
It's a great question. A testament to our drive to understand everything, I suppose.
Well, if anything we talked about today sparked your curiosity, definitely check out some of those resources. Look up PubMed, browse the Patent Office site, maybe find a local medical library or association.
There's always more to learn.
Absolutely. Go discover it.